Welcome to ProSpeak English. Let's learn to speak English with confidence.
Welcome to our Hospital English series. In this first lesson, we are at the reception desk. When you arrive at a hospital or clinic, the first step is checking in. Listen carefully to how David provides his personal details and describes the reason for his visit.
Good morning. I would like to check in for my appointment.
Good morning, sir. Do you have a scheduled appointment with a specific doctor today?
Yes, I have an appointment with Dr. Smith at 10 a.m. My name is David Miller.
Thank you, Mr. Miller. I see your name on the list here. Is this your first time visiting our hospital?
Actually, yes, it is my first time here. I usually go to a clinic closer to my house.
I understand. Since you are a new patient, I need you to fill out this registration form. Do you have your ID card with you?
Yes, I have my driver's license right here in my wallet. Do you need my insurance card as well?
Yes, please. We need to scan your insurance card for our records. You can hand both cards to me.
Here you go. Regarding the form, do I need to fill out the entire page?
Please fill out the front side with your address and contact information. You can leave the back side blank for now.
Okay, that sounds simple enough. Do you have a pen I could borrow?
Of course. Here's a pen. You can sit in the waiting area while you fill that out.
Thank you. By the way, is Dr. Smith running on time today?
He is a little bit busy, but he should be ready for you soon. Just bring the form back to me when you are done.
Great. I will finish this quickly and bring it right back to the desk. Thank you for your help.
In this conversation, we use the phrase check-in, which means to register your arrival. We also talked about filling out forms, which is very common in medical situations. In the next lesson, David will describe his symptoms to the nurse. See you there. Now that David has checked in, he is in the examination room. As a nurse, I need to understand exactly what is wrong so the doctor can help him. Listen to how he describes his pain and symptoms.
I am glad to finally sit down. My leg has been bothering me all morning.
I am sorry to hear that. Can you tell me exactly where the pain is located?
It is mostly in my right ankle. It feels very stiff and sore, especially when I walk.
I see. On a scale of 1 to 10, how would you rate the pain right now?
Right now, while I'm sitting, it's about a 3, but when I put weight on it, it goes up to a 7.
That is significant. Did you fall or twist it recently?
Yes, I was playing soccer yesterday afternoon. I landed awkwardly after jumping for the ball.
Did you hear a popping sound when you landed?
No, I did not hear a pop. I just felt a sharp pain immediately.
Okay. Have you noticed any swelling or bruising around the ankle area?
It looks a little bit swollen today. I haven't seen any blue or purple bruises yet.
That is good to know. I will make a note of that for the doctor. Is there any other discomfort anywhere else?
No, it's just the ankle. The rest of me feels perfectly fine.
Describing symptoms clearly is very important. David used words like stiff, sore, and swollen. These are great adjectives for medical situations. Next, we will check his vital signs. Before the doctor comes in, it is standard procedure to check the patient's vital signs. This usually includes blood pressure, temperature, and pulse. Listen to the instructions I give David during this process.
Should I roll up my sleeve for the blood pressure check?
Yes, please roll up your left sleeve. Relax your arm and rest it on the table.
Like this? I always get a little nervous when getting my blood pressure taken.
That is perfect. Just breathe normally and try not to talk for a moment. I am putting the cuff on now.
Okay, finished.
Your blood pressure is 120/80, which is very healthy.
That is a relief. I was worried it might be high because of the pain.
Pain can sometimes raise it, but yours looks fine. Now I need to check your temperature.
Do you use the one that goes under the tongue or the one for the forehead?
We use the forehead scanner. It is much faster. Just hold still for 1 second.
Okay, I'm ready.
Beep. Okay, your temperature is 98.6 degrees, no fever at all.
That is good news. I didn't feel hot, but you never know.
Finally, I'll just check your pulse on your wrist. Give me your hand, please.
Here you go. My heart might be beating a little fast.
It is slightly elevated, but that is normal when you are in pain. The doctor will be in shortly.
Thank you for being so gentle. I'll wait here for the doctor.
Did you hear the numbers? 120/80 is how we say blood pressure readings. We also used verbs like roll up, relax, and hold still. These are commands you often hear in a hospital. Up next, we discuss the diagnosis. The doctor has finished the examination. Now I am back to explain the doctor's instructions to David. This part is crucial because David needs to know how to take care of his injury at home.
So, what is the verdict? Is my ankle broken?
No, it is not broken. That is the good news. It is just a moderate sprain.
Oh, thank goodness. I was worried I would need a cast.
You won't need a cast, but you do need to be careful. The doctor wants you to follow the R.I.C.E method.
Rice? Like the food? I don't think I understand.
No, not the food. It stands for rest, ice, compression, and elevation.
Ah, I see. Could you explain what I need to do for each step?
Sure. Rest means you should stay off your feet as much as possible for 2 days.
Okay, I can do that. And what about the ice?
Apply an ice pack to your ankle for 20 minutes every 3 hours. It helps reduce swelling.
Got it. 20 minutes of ice. And compression?
You should wear this elastic bandage. It supports the joint. Not too tight, though.
And finally, elevation means lifting it up, right?
Exactly. When you sit on the sofa, put your foot up on a pillow so it is higher than your heart.
That all makes sense. How long will it take to heal completely?
If you follow these rules, you should feel much better in about a week.
I will follow the instructions perfectly. I want to get back to playing soccer soon.
The R.I.C.E method is a very common piece of advice for injuries. We also practiced asking for clarification. David asked, "What does that stand for?" Or, "Could you explain?" These are perfect questions when you are learning something new. Final stop, the pharmacy. David is almost ready to go home. He just needs to pick up his prescription. We are now at the pharmacy counter. Listen for the dosage instructions. This tells him how much medicine to take and when.
Here is the prescription paper the doctor gave me.
Thank you. I have your order ready right here. It is a pain reliever and an anti-inflammatory.
Do I need to take these with food or on an empty stomach?
You should definitely take these with food. It prevents stomach upset. A full glass of water helps too.
Okay, and how often should I take them?
Take 1 tablet every 6 hours, but only if you are in pain. Do not exceed 4 tablets in 1 day.
Understood. Maximum 4 per day. Does this medication make you drowsy?
It might make you a little bit sleepy. I recommend not driving immediately after taking it.
That is fine. My wife is picking me up, so I won't be driving today.
Excellent. Here is your receipt. Do you have any other questions for me?
No, I think that covers everything. You have been very helpful today.
You are welcome. Just remember to rest that ankle. If the pain gets worse, come back immediately.
I will. Thanks again. Have a good afternoon.
And that concludes our visit to the hospital. We covered checking in, describing pain, vital signs, diagnosis, and pharmacy roles. If you enjoyed this lesson, please subscribe for more. Take care of your health and see you next time.